Welcome to the Vet Dental Show. I'm Brett Beckman, board certified veterinary dentist, and we bring this podcast to you every Wednesday as a veterinarian, as a technician, as a dentistry team to help you be even better at veterinary dentistry in your practice. We're sponsored and partnered today with the Veterinary Dental Practitioner Program. If you're interested in being among the best anywhere in general practice as a team in veterinary dentistry, I invite you to request an invitation. Just go to ivdi.org/INV, like invitation, first three letters INV. So IVDI, International Veterinary Dentistry Institute, ivdi.org/INV, and we'll get you the information that you need.
So the first question comes from Alicia. Any handouts that can improve discussion when talking about partial mandibulectomy? And we really don't have handouts for that. I don't know if anybody has handouts for that. It's not something that we see very often, but I think the root of your question is what type of client education should we give for that procedure? And it's fairly common, whether it's associated with an mandibulectomy, which is the most common, which we talked about in this case, or some other mass that we have to take a part of the bone away to remove the entire mass. So from the standpoint of client education, I talk to clients from the position that this is, from a post-op management standpoint, most of the time a complicated extraction, mandibular canine extraction, something to that level of analgesic management post-op. It's not particularly something that is devastating for the patient at all. And so the owner should know that when we remove teeth, we also remove a lot of bone, especially the mandibular canine, where that bone is thick around that tooth. It's thicker as we get to the tooth root. And so we're going to be removing a lot of that bone in the extraction. And we're just removing a section of the bone when we do an ectomy, a mandibulectomy. And that section is generally tissue that's not painful because we're going into normal tissue, normal bone when we do it, removing the mass in total. The mass may have inflammation associated with it, and that's uncomfortable, depending on what it is. And again, we're talking about a mandibulectomy for this case. So that component of the chronic pain and the wind-up pain is not present. So NSAIDs, and generally we use a fentanyl patch, your analgesics of choice for that. And we don't really need anything that covers chronic pain like gabapentin, because we're not dealing with chronic pain usually. So the excision needs to be protected with an Elizabethan collar because we don't want any self-trauma. We don't want other pets around that. We don't want any bones from that standpoint, from a client education perspective. Nothing hard. Depending on where it is, we're probably going to recommend soft food for 2 weeks. The thing that we are concerned with, and we talk about this more in depth with clients when they call for referral, and you'll find the same thing in general practice. The referring veterinarian is going to, or the veterinarian is going to provide the client, the specialist is going to provide the client with that conversation and answer those questions. In my case, a lot of times they are very well educated before they come in, because my dental technician, Annie Mills, who's been with me for 12 years, does all that beforehand. So our conversation is just more or less quick questions that they might have. They're pretty well educated, and I think you'll find that with any specialist that you're going to be referring these to. Now, if you've been to our extraction courses, you've been to our advanced course, you may be comfortable doing mandibulectomies that aren't major mandibulectomies, and are comfortable with the procedure and comfortable with talking to clients. So those are some of the things that you can take away from that. And your experience with that will begin at some point, probably, if you're pursuing dentistry, if you love dentistry. We can always facilitate that. We have courses that will allow that to happen. So Cindy has a question. Is there ever a time when you would not want a GP to biopsy an oral mass first? Good question. Excellent question. I'm asking because I did a biopsy on and received flack from a coworker for not referring straight away. In our situation, just personal preference, I would prefer that if, as long as you don't have to get really involved and in depth with the biopsy, as long as you can take a soft tissue section of the mass without having to get down into bone and get aggressive, then I would personally prefer, and our service as specialists would prefer, that the biopsy be done, and then all we need to do is do the imaging with dental radiographs. If you have CAT scan, that may be an option. If your specialist has CAT scan, CBCT, that's certainly something that is done. I don't see that it's that beneficial in most cases of mandibulectomies, which is mainly what we're talking about in this case. But it can provide a lot of benefit in some cases, especially in the maxilla, where there's a lot of air densities that can superimpose over the mass itself and the bone destruction. So it makes it more difficult to find what kind of margins you need. So back to that question, I would prefer a section. When you take a section, many times, especially with a mandibuloblastoma, you're not going to be able to suture. You just take a section, just a slice of it is fine, and send that in. Just make sure that you're down into the tissue and not just really superficial. It's a 1.5 millimeter slice should be plenty in depth in order to get to where you don't have a lot of bleeding at the biopsy time, and that coagulates fairly quickly. You don't have to worry about that. If you try to excise the whole mass as it exists, then that can be more of an issue and certainly can disrupt margins for the specialist visually. So it's best just to biopsy, and then we already know what we're dealing with. The client comes one time. They come in for the evaluation in the morning with the pet, and the pet stays. We do the procedure based on our imaging, getting good margins, and then it's one and done for the client. And a lot of times the clients, wherever you guys are going other places, and they're having to travel, they would rather you do that than have to go and get that done at the referring vet and then come back, or at the specialist, and then come back and have to do that again after the biopsy comes back. So time-wise, it's better too, because a lot of specialists are booked a couple months out, so you have to wait for that period of time, and that wait can allow that mass to progress, usually not dramatically with a mandibuloblastoma, but certainly is a factor when you look at time. So might be better in almost every case to get the biopsy first. And Cindy, I don't think that anybody would argue with that, as long as it's it's not too aggressive and it gets the job done. If we see what we can do, and in our services specifically, where we do the procedure the same day for the client benefit so they don't have to come back? Good question.
I hope you enjoyed that episode. If you'd like more information about the Veterinary Dental Practitioners Program, please submit to request an invitation at ivdi.org/INV.